Functional medicine is an innovative approach to healthcare that focuses on wellness, prevention, fitness, and nutrition. It is a strategic way to look at all of the issues that impact health so that the person can be as healthy as possible. Dr. Jeff Welchel, who is a good friend of mine, joins us today, along with Dr. Bruce Clark, both of them doing great things in our area. They're from the Center for Functional Medicine, to talk a little bit about kind of how medicine is changing. And I don't know who wants to go first, but just tell us overall, what is functional medicine?
Well, functional medicine is going to be the future of conventional medicine. It's going to more the root cause of illness. Instead of just blaming an illness and giving a medication, we're going to see what's causing the illness using different modalities like lifestyle and looking at patients through a different lens of healthcare, working with them in a partnership.
And so I guess it's kind of a paradigm shift, Dr. Welchel, in that we go from, well, sick care, typically if I'm coming to see you, I need a shot, I need some medicine, to true health care.
Correct. You know, we call it more proactive instead of reactive. Instead of treating symptoms with the medicine, we try to identify issues before they become that big of a problem and try to correct the path.
So how would that work in your office as opposed to typically coming into a traditional doctor's office? What kind of sets you guys apart? What do you do that's different? Dr. Clark?
We're going to spend a lot more time on their history. This visit may take up to an hour. Using their history and their lifestyle choices that they're making, also along with maybe environmental issues in their life, whether it's toxins or other things in their environment that are affecting their health that might be causing symptoms of illness. So that's how we're going to attack that patient. So it's not 15-minute visit, it's a long
full encompassing.
Yes.
Well, and we also in-house have a nutrition coach, and we have a fitness coach, and we have a health coach that calls the patients periodically. You know, all of us know in January, you know, we start these, we're going to exercise, we're going to get healthy, and then 2 weeks, 4 weeks later, we fall off the wagon, fall into our old habits. But, you know, now we have people that are calling, just kind of adding some encouragement, some accountability, so that people can just stay on the wagon.
Again, putting the focus on the overall, the healthcare, the word. And you guys do all the testing, all kinds of stuff there, right? Extensive
lab testing, you know, we do, and we do it as we go on. As we find some abnormalities, you know, we always try to let the body heal itself first.
Right.
And
it's typically very good at that.
Absolutely. God kind of knew what He's doing.
Well designed,
yes,
beautifully
exactly
and wonderfully made, no doubt about that. Well, let me ask you this. What things do you focus on in the testing? What specific things?
Inflammation, oxidative stressors, the immune system response to disease, looking at different biomarkers that probably most physicians aren't looking at currently, and to give us a better idea of where we can lead this patient as far as nutrition especially.
So, I mean, hormone issues?
Kind of in layman terms, yeah. Hormones, cardiovascular issues. If you've got a family history of heart disease or, you know, diabetes or pre-diabetes, we've noticed that, you know, over 50% of people in Amarillo meet the criteria for pre-diabetes or diabetes, actually up to 2/3.
So you're not treating the specific disease?
No, you treat the body.
You treat the body.
And most of the time, the body will heal itself. If it doesn't, that's when you start looking, okay, is there some exposure in their environment that could be causing the problem?
Phenomenal. I mean, it really is. It takes a minute to get your mind around it. So what if we've got clients out there that want to know a little bit more, our viewers want to know a little bit more about what you guys do, and how really to maybe switch over and start looking at this new method?
They can go to our website. They can go, we're located on Cornell Street. We're attached to the Town Club in Cornell, and we have people there all the time that can call and we can talk to them.
I want you guys, if you write this down, it's cfamarillo.com. You can look them up on the website. You can also call them. You can go in for a tour. They'll tell you how it works. And Dr. Clark, so nice to meet you. Dr. Welchel, I've known you for 20 years now. I just think you're incredible at what you do. And I know as a patient of yours, like you're the best. So we appreciate you guys coming in. Still to come, have you ever wanted to bring the table